Hello, everyone. I'm Barry LaForgia, the Executive Director of International Relief Teams. I just wanted to let you know that we'll be starting in about a minute, just to allow people to get on. And I also wanted to tell you, if you hear any thumping in the background, it is because they're doing construction right outside our office. And they are doing some pile driving, unfortunately. So if you hear any thumping, that's what you are hearing. We're glad to have you all on board today. This is our second IRT Live, and it's a great opportunity to share with you what we're doing directly, and also to have you ask any questions about anything we are doing and how we do it. So we look forward to filling you in on what's been going on the last 3 months. A lot of it you already know, at least the events. So it's great to have all of you here. And I assume that I think we should start. What do you think, Eric? Rose?
Let's go ahead.
Okay, very good. Very good. We're going to divide this into kind of 3 areas. I'm going to speak about disaster relief, and then Rose is going to talk about our non-disaster programs, and then Eric's going to talk about our upcoming gala. So that's going to be the format, but you can ask questions at any time you want. You can interject and ask any questions you have, but I'll start off with the disaster relief components. As you know, Hurricane Ida was a pretty intense storm, and killed 71 people, at least as of the latest figures, and it caused extensive damage, along its path. And as you know, that there's still a lot of people without power in Louisiana, and that's where we have concentrated our efforts, is helping out down there. The first thing we did was to rush over $100,000 worth of ready-to-eat meals. That came to nearly 14,000 meals that came over from Florida, from a supplier in Pembroke, Florida. The way we work with disasters is we have partners that we get in contact with even prior to the disaster, so that we know who's going to do what, so we don't duplicate each other's efforts, and we can be as efficient as possible and effective as possible in getting our supplies and what is needed to the area as quickly as possible. So our first response, as I said, was the ready-to-eat meals. The next thing we did was we ordered from a supplier in Chicago 2,500 solar lanterns. These are rechargeable solar lanterns that have an outlet on there, a plug-in where people can plug in their cell phones so that they can keep their cell phones charged. This is very important for the people that are without power, and they can maintain their contact with their loved ones and friends, and also with local authorities as to what is going on. The next thing we did was to help out the people who suffered extensive damage to their homes, or most likely roof damage, because it was a Category 4, which meant the winds were very, very high. And as a result, a lot of people suffered roof damage. So we ordered over 4,400 tarps out of New York City. The irony of all that was that when our partner's truck came in to pick up the tarps, that's when Ida was hitting New York. So they had to hang about a day and a half on the outskirts of New York before they could get into New York and pick up the tarps. But we did get the tarps down to Louisiana, and they have been distributed. So we've invested about $250,000 into this disaster already. And so I just wanted to open up to any questions that you might have about Ida, and then we'll go on to the next event. Any questions?
Sure.
Okay.
How do you identify who gets it? Who do you deliver it to? And
Okay.
How does it get distributed?
We're working with Convoy of Hope, a large nonprofit, one of our traditional partners that we use in disasters. They sent a fleet of 17 semi-trailers down there loaded with other supplies. When we had talked with them, they were going to handle food, water. Another partner handled medicines. And so we were handling the shelter, temporary shelter items and the ready to eat meals and the solar lanterns. But they set up in one major location down there in a warehouse situation with their 17 semis. And then they set up various distribution points, one in Homa and another in Gonzales, and then they had another third site. And so they distributed from those points there. And that's how the distribution took place. So we did not actually do the distribution. We worked with them.
Okay, how are they coordinating with local people in order
Yes,
to identify
yes.
who gets what and when?
That is correct. That's kind of how it works. When you get on site, because we've been on site before, you find out what other agencies are there, and then usually there is the FEMA. FEMA basically on a U.S. disaster kind of helps with the coordination of who's going to do what, who's going to set up what, and how are we going to distribute and to whom are we going to distribute. So we get our marching orders pretty much from FEMA or local authorities.
At what point does those marching orders come to say how much you should send on down, or you just decide? Who decides how much to send down? And
we don't contact FEMA. FEMA does a lot of work with setting up, getting people to file claims for their people need temporary lodging. They'll file a claim with FEMA. They need some per diem to buy essential supplies. That usually comes from FEMA, but that's a process that takes some time. The nonprofits kind of bridge that gap between the time that they can file their paperwork with FEMA. So we're coordinating with other nonprofits there as to what we have and how we're going to distribute it. The FEMA claims they kind of kick in a couple of weeks afterwards. I remember in Katrina, because I was there personally with one of our teams in Katrina, and people were filling out the paperwork with FEMA as we were giving them their supplies that they needed right now. So there is a time gap with filing claims for FEMA. And of course, with regards to people that had damage to their homes, they file with their insurance carriers, and takes a 4 to 5 month process on average.
okay, so before it even gets down there, you made a decision or somebody made a decision. How many tarps are we sending down there? How many lanterns are we sending down there? Are there other things? How do you identify? How do you know how much? How do you know what?
Well, usually, Jerry, we're limited by what kind of our funding, how much can we afford to send down there, given the fact that we have a disaster relief fund. And we decided early on that we would go out and advance about $250,000 to this disaster that's before we even collected a penny from any of our donors. So we made the decision that we were going to be good for about $250,000. So then we contacted our partners and said, okay, this is what we can do. What do you want us to apply it to? What are you going to cover? What we're going to cover? And that's where they said, well, why don't you take care of the MREs? So we applied $100,000 to MREs. We applied $50,000 to the solar lanterns, and then we applied another $100,000 to the tarps. Now, there's other organizations that are supplying other things that we are not in direct contact with. So we basically know that we're not going to cover the whole disaster. We're just trying to do our part.
Okay.
Right.
Okay, great. Good. That gives me a picture of what goes on. Thank you.
Sure.
Yeah, I had a question for you, Barry.
Yeah, John.
First of all, thank you for all that you're doing. I'm just wondering about the people who are involved in the actual loading and unloading of trucks, people who are actually distributing, driving the trucks. are these people volunteers, or are they employed by the partners with IRT that you mentioned? Who are these people?
That's a very good question, John. The way Convoy works is Convoy positioned 17 semi-trailers outside of the disaster zone until the storm passed. So they were already, and Convoy's headquarters are in Springfield, Missouri. They had come into, I believe, Texas and kind of parked there knowing that they were on the outside of the storm. They were west of the storm, and they were pre-positioned. On their trucks, besides relief supplies, they have forklifts and other things to help unload the pallets that are on the other trucks. And they also have employees that drive the trucks down there. They're employees. But what they also bring down are volunteers to help with the distribution. And that's how they work. I'm not saying every organization does it that way, but Convoy does it that way, our traditional partner.
Okay, thank you.
Right.
That traditional partner Convoy, is that just about every type of disaster IRT's been involved in?
No, they mostly, we use them with US based disasters. Now they were involved in the Haiti earthquake, and they were involved in Bahamas. So they kind of try to stay within the Western Hemisphere disasters. And but internationally, we've used other organizations. We've used, we've used a lot of times our partners who we've had relationships with for some of our non-disaster programs. For instance, when the hurricane Eta and Iota hit Honduras and Guatemala, well, we have already had relations down there with partners that we use for other activities, such as our I teams and our Guatemala food program. So we use them as our distribution agents for getting our supplies out to those in need. So sometimes it's a partner that we already had a contact with. There's another international organization that we've used a lot, and we've used them with the Rohingya refugee crisis. We've used them with the Philippine disaster when the Hurricane Haiyan hit the Philippines a couple of years ago. And we've used them in Lebanon during the explosion in Beirut in the last couple of years ago. They're concerned worldwide, and we've used them for international partners. So a lot depends on whether you have any pre-existing relationships in these countries. If you do, it speeds the process. You already have a relationship, and they become your distribution partner in those countries. Okay, any other questions? Okay, I'm going to go on to the Haiti earthquake just to tell you what we've done. You know, the Haiti earthquake left about 53,000 homeless, and we did the tarps and we did the solar lanterns. Again, pretty much the same quantities that we sent to Louisiana, we sent to Haiti. And we used Convoy of Hope as our partner there, because Convoy already had a presence in Haiti through a sub-organization called Mission of Hope. It's kind of a subsidiary of Convoy of Hope. They had 40 or 50 personnel down there. So they were already positioned. Now, we sent the supplies through Miami. It took only a day to get them down there by boat. And they went into a port on the western side of the island. And then they were unloaded and put on another barge that took them down to the southwest part. And then with police convoy, they were brought into the area of the disaster zone for distribution. But they already had 40 to 50 personnel that were part of the Mission of Hope organization to help do the distribution. Again, having that on-site presence kind of streamlined the process. Any questions about Haiti? Okay, I'm going to move into COVID relief. We got a request from India a few months ago for PPE. As you know, the Delta variant started in India in a very profound way, and it really affected India right away. And so they needed personal protection equipment for their health workers. And so we airlifted 3 shipments of PPE with another partner, MAP International, who we use for our medicines. They had a whole warehouse full of PPE. It was just a question of getting it over there. So we already had 3 air shipments into India. We had the first air shipment was 60,000 barrier gowns. And then we had, and then the next shipment, we had gowns, we had the barrier masks, we had N95 masks, we had and stethoscopes, which is what they asked for. So that went in the second shipment. And then the third shipment, we sent in 60 oxygenators to help with the airflow and helping patients breathe. We have 2 more shipments lined up in October. We're just waiting for customs clearance papers to get those 2 shipments into India in October. Any questions? Okay.
Barry, I wanted to ask a quick question, if it's okay. I'm just wondering about the shipments that go to Haiti and to India. I have concerns, and maybe you can help me understand better. But whether or not, whether the materials that we're trying to distribute are being distributed fairly and equitably. Sometimes on the news, you'll see reports and it looks like things are a bit chaotic and they're maybe are not getting into the hands we would like them to get into. I'm just wondering how much of that is an issue. Is that just something where watching the media that can distort what's really going on? Or is that a real issue when you're trying to do this in a place like Haiti after an earthquake, or in India, suffering from the pandemic? Is that a serious concern or not?
We always vet our partners and who's doing our distribution. If we have long-standing relationships, we've already had that vetting process going on. I think the problem arises when you have a startup nonprofit that all of a sudden now says, send me supplies and we'll distribute it. And you have no idea of who they are. We don't use those people. We just don't use them. We don't touch them. So even the organization in India that's distributing to those hospitals, our partner MAP International has had a long-standing relationship with that organization. So they've already been vetted. One thing that we can't control, John, and that is when we send our medicines to other countries and any product, is the individual practitioner, the nurse who might throw a couple of pills in her pocket and walk out of the hospital because she wants to use it for her own family or something like that. That is hard to control. But at least the organizations that we distribute to and the hospitals, they've all been vetted, and they have proved over time that they are trustworthy and that their processes are correct and are done properly. But that individual practitioner or individual person who might stick something in their pocket, it's hard to control that.
Right. Thank you.
Right. So the other thing we've been doing with COVID, of course, has been supplying our local food bank with food. It's an interesting thing. Normally, we have our Feeding San Diego Kids program where we help provide food for the kids that are underprivileged and homeless that attend school here in San Diego County. And usually we get our food from the food bank. The food we do is for the weekends. We know that these kids are getting their federally mandated meals during the week, but on the weekends, we don't know what their source of food is. So we give them a backpack to provide them and their family with food on the weekends. So normally the flow of food is from the food bank to us. Well, during COVID, with the schools shut down, we reversed that process. We basically said, what can we do to help out with COVID here. And so we have sent over $1 million worth of food to the food bank since May of 2020. According to the food bank, we've provided over 660,000 meals, and we've become their biggest supplier of food. And to do that, we basically use a lot of our suppliers that we use in disaster relief to help find and source food here in the United States to deliver. It's all non-perishable food that we're delivering to the food bank. So we've been doing that. Any questions about that activity? We're hoping to continue that. In fact, we're planning to continue that for the next 8 months, till at least through April of 2022. The other disaster relief activity that we've been involved with is Syria. We've been providing medicines and supplies to doctors who are in Idlib province. Idlib province is that one province that's still not controlled by the Assad regime, and people are getting bombed regularly there. We've been providing hospitals as well as refugee camps along the Syria-Turkey border. And we're working with a group called Save the Syrian Children. They're our distribution partners there. And to date, we've got our supplies out of Europe, out of a company in Netherlands, and they're shipped down to the port of Mersin in Turkey. Then they're put into trucks, taken to the Syrian border, where they're distributed into even smaller trucks and are brought in across the border into Syria. So we have another shipment prepared for later this month or early October. Any questions about our disaster relief activities? I think I've covered everything. Did I miss anything, guys? Anybody got it all? Okay. I'm gonna
question here. I'm
Yes,
looking at math. You said 1 million in local food bank, 250,000 in for Ida and Louisiana. What's
Yes.
the other ones? What?
Haiti, about we 150,000 for Haiti.
Okay.
Oh,
So-
200,000. I'm sorry, Jerry, 200,000 for Haiti.
So the food bank, local food banks, some far and away get the most.
They've gotten the most. That's been an ongoing monthly event on our part. Yes, it has. The food bank is an ongoing situation for as long as COVID has lasted, and we made the decision to do that. And we also got some grants to help support us in that activity. So that really allowed us to continue that ongoing support. We recently got $1 million grant to support the food bank, the activity we're doing with the food bank.
So that was local money coming for local purposes.
Yes, exactly.
Okay, because I'm from out of town. I have food banks up here. So when I think about where should
I understand that. And, you know, we can't help every food bank in the United States, but we decided to help our own one locally. And luckily we got local sources of funding to help support us in that activity.
Thank you.
Right. Okay, I'm going to turn it over to Rose Ranga. She's our Director of Operations and Program Development, and she's going to talk to you about what we've been doing in non-disaster relief activities. Rose?
Sure. Jerry, I'm just curious, where are you from?
You're muted.
Seattle.
Seattle.
Oh.
Okay.
Okay, great. Well, I'm going to talk about our long-term recovery efforts in California related to the fires of 2018. You've probably all seen on the news, even if you're not located here in California, we've had a terrible year with fires, and there's still many fires going on right now. One of the things that we do is we help with long-term recovery. So in 2018, we had devastating fires here in California, very destructive. There were 85 people that lost their lives, and an estimated 30,000 families that lost their homes. You might remember on the news the small town of Paradise, California, was almost wiped off the map. About 5% of the buildings in Paradise were unaffected, but that was it. So we work with partners again. We are working with Hope Crisis Response Network. They are one of 2 nonprofit organizations that's been authorized to do disaster recovery relief in California. So needless to say, they have their hands full. There's another organization, Catholic Charities. They are responsible for vetting people that need assistance. We're looking to help people that are low income, uninsured, elderly. Basically, they can't recover on their own. So in partnership, we work together with Catholic Charities and with Hope Crisis Network. Our partner on the ground is Hope Crisis Response Network. And what they do is they have construction managers, they're on site, they're coordinating with, okay, Catholic Charities has vetted this family and they are ready to have their home built. So our partner they're in charge of, providing construction materials, for instance, coordinating the delivery of construction materials on site. What we do is we provide skilled volunteers. So we've been doing this for years and years and years in many different disasters. We worked in Louisiana after Hurricane Katrina for 6 years, I believe it was, Barry. So anyway, this is one more 6.5 years. So in Paradise, we had to stop sending volunteer teams during COVID, but we were able to send our first team in July of this year. So we had 8 construction volunteers that went to Paradise, and the 8 of them helped to rebuild 3 homes. So in just a 2-week period, they were able to help 3 families get back into their homes. And these are people, again, that would have had no means to be able to do this on their own. We had a second team that went in August, and again, framing homes, getting homes ready for people to move back in. We have construction teams scheduled for this month, also October, November, and December. And one of the things that we're really trying to do right now is build up our construction volunteer forces. As you know, disasters are becoming more frequent and more severe, and our services are needed now more than ever. We normally send about 6 teams a year to construction sites, basically every other month. They would love for us to come every month. Our volunteers are highly skilled. They have other volunteers groups that go in that maybe it might be college students or church groups, and they might go in and paint, let's say. But they really don't have many skilled construction teams. So one of the things that they've mentioned to us is that they would love it if we could send volunteer teams every month. They say that our teams are so good that, when we leave, they never ever have to go in and redo anything. So we're very proud of that. But on the other hand, we would love to build up our volunteer team so that we can provide even more services. We have, if any of you are interested either in volunteering on one of those teams, we have both skilled and non-skilled workers. Over the years, we've taken people that have come to us that are completely no construction skills, but after going on team after team after team and being trained, they're highly skilled now. So if any of you have a personal interest in going, or you know of others, people or groups that might be interested, we'd love to hear from you. We would really like to build up that program. Anybody have any questions on that?
Yeah, Rose, I would like to ask you a question if I could.
Sure.
You mentioned that I think it was 30,000 people in Paradise or the Paradise area lost their homes in the 2018 fires. I'm just wondering if you happen to know what percentage of those people do not or did not have coverage for their loss. Do you happen to know that?
I don't know the percentage. I do know that part of the cause of the problem was with the electric company. And so people are filing claims trying to get some type of money to rebuild. I can't tell you the percentage of people, but Paradise is very poor, very elderly community. Some people have not even been able to afford to go back there. They just didn't have the means to rebuild and said, well, you know, let's go move in with other family members someplace else in the country. So no, I can't tell you that percentage. I can tell you right now, it's a slow process vetting people. There are 25 houses right now that are ready to be built that we haven't started building yet. Our partner estimates that they will be there for at least 5 years.
You know, I also wanted to ask, you mentioned that there were about 4 or 5 homes that had been rebuilt by volunteers. I'm wondering, were those homes built on the same sites where they were before the fires came through and burned them down? Were they built in the same sites or different sites? Or
no, the same sites, because it was land that the people owned. And so their houses burned down there. They had to rebuild on the land that they owned.
Is anything being done to try to make the homes more fire resistant in some way? I'm just thinking about that, about future fires also going through the area.
Sure, not only making the homes more resistant, but also the areas. You know, they were totally stocked. Paradise was totally stocked in and surrounded by the fire, and it grew very fast. There are a lot of programs to look at, to take care of brush clearing for instance, to do planned burns, to educate people on taking care of their property. And so a lot being done in the area of mitigation, fire mitigation. Yes. That's not something we personally do as an organization, but yes, there is a lot going on with different nonprofit organizations and also FEMA, the government in those areas.
Okay, thank you.
Sure.
Who's your partner there, Rosa?
Hope Crisis Relief Network.
Oh, okay, same as before. Oh, okay, got it. Right, you said that already. What's the commitment that volunteers make? That would be one area that I consider.
Sure. 1 week. So our volunteers leave on a Sunday. We make all of the travel arrangements. We have the lodging arranged. So basically you commit to 1 week. We leave on a Sunday, fly there, work Monday through Friday, full days, half a day on Saturday, and then fly back again on Sunday.
Are you sending people out from San Diego then?
All over the country.
So I could fly in from Seattle and meet.
Sure.
Wherever you're landing. Okay.
Yes, all of our volunteer teams, our volunteers come from all over the United States. So we have people from Florida, from Michigan, you name it. That is not a deterrent at all. So absolutely.
Okay. I think I'll certainly keep that in mind.
Thank you. Any other questions on that? Okay, then I will move on and tell you about one of our other programs. It's called Kids Kingdom, and it's an orphanage just right outside of Ensenada, Mexico. We've worked there for many years, 10 or 12 years. This orphanage they maintain about 44 kids. What's really special about this place is that it's more of a home than an orphanage. The directors, Tomas and Maricela, have been there for 20 years, maybe more. They are very committed to these kids. The kids refer to them as Mama and Papa. They're very involved in their lives. What we've committed to do there is to make sure that the children get fed. So, at least 3 healthy, nutritious meals a day. And we also provide for their education. So in Mexico, you have to have a uniform, you buy your own books. And so they wouldn't be able to attend school without our support. We've been doing this, like I said, for many, many years. To tell you just a short little success story here, there's a young lady by the name of Karen Milan, and she went to Kids Kingdom when she was 4 years old. She was found on the street, basically digging in garbage cans for food, and the social services group there in Mexico, they took her to Kids Kingdom. So at 4 years old, she was taken there. She was able to start school. They make sure that they get them medical help, make sure these kids are healthy and have overcome, what they've been through in their short little lives. Today, Karen is 23 years old. She is attending university in Mexico, and she is working on becoming a social worker. And her dream is to become a social worker and help children that were in the same situation that she was in. She's a very bright, energetic young lady, and we are seeing more and more of the kids out of Kids Kingdom going on, graduating from high school. That's a big deal. They come from families that have never even gone to school. So graduating from high school, going on to attend university. I think there's about 6 of them right now that are attending the university. So Tomas and Maricela are very proud of these children, and they come back home just like any other college student would come back home to see their parents, and it's really a very special place. So we are proud to support that, and we will continue to do so. Any questions on that? Okay, I'll talk about Guatemala. Guatemala is a very, very poor country. 2 out of 3 people live on less than $2 a day. We have been working in Guatemala for about 27 years now. We have partners in Guatemala, just like we do in our other programs. We have responded to various disasters in Guatemala over the years. We've had health programs. We've sent teams of doctors and nurses into remote areas of Guatemala where we've provided, basic health care, dental assistance, surgical procedures, and eyeglasses. We are currently doing eyeglass programs, although right now they're on hold because of COVID and we're not able to send in volunteers. But that's another program that we do in Guatemala. and then one of the big problems in Guatemala is malnutrition. It's estimated that 47% of children under the age of 5 are stunted, which means that their growth, both their growth and their mental capacities are impaired, have been impaired. A big cause of this is malnutrition. So for the past 12 years, we have been involved in a program of feeding 10 to 12,000 children between the ages of 6 months and 2 years. And we do that, we've done that every year for 12 years. What we're doing is we're providing a food supplement. It's highly fortified, vitamins, minerals, and if you can provide these children, from 6 months to 2 years with the nutrition that they need, you can prevent the stunting. Once children have the stunting, there really isn't a way to go back and correct that. So we're working to prevent that from ever happening. We have a partner there that we work with that takes care of the distribution. I've been there to visit the program. It's very impressive, the whole network of people that are involved, and the clinics that are involved, and the mothers that bring their children in to receive the supplement. It's very organized and very controlled. Yeah, I think that's all I have to say on that. Do you have any questions?
Hey, Rose, I was just wondering about the people you mentioned, the children. You said 47% of the children are stunted, and that's why we're trying to get the nutritional supplement to them. Are those 47%, are those predominantly indigenous people in Guatemala, or are they a mix of both the indigenous people as well as the rest of the population that lives more in the urban areas? I'm kind of thinking about those that live out in villages and small towns versus those in urban areas.
Sure.
Is there a breakdown on that?
Oh, sure. It is a mix, although in indigenous areas, there are some indigenous areas where that stunting is as high as 80%. So the indigenous are definitely more affected by it. And our program is especially targeting those areas. So going into those little small villages and clinics where the indigenous people are served. So yeah, it's definitely more so. There is a mix, but definitely more predominant in the indigenous communities.
Okay, thank you.
Okay. If there aren't any other questions on that, then I will turn it over to Eric Folkler, our Director of Philanthropy, and he can talk about some upcoming events.
Hi, everybody, and thank you for joining us today. We really appreciate it. I'll just be quick because I know we've been on here for a while, but we have an annual gala every year. And so any of you who are in the Southern California area may know that we have an in-person event every year, and we have a nice ballroom and have a lot of fun. But for the past 2 years, because of COVID, we have been virtual, and we had to make the decision again this year early on that we thought it'd be safest to be virtual this year. So it's been kind of nice actually, because it's allowed us to invite donors and supporters from all across the country to be able to join in with us. And so this year on September 25th, 5 o'clock, it's a Saturday, we're doing our Gifts of Hope virtual gala. And it's going to be fun. We've got some wonderful folks lined up. It's short and sweet, but we hope that you can join us. At the end, we'll have some really great drawing prizes available. Things like a dream vacation to anywhere in the world, and a cruise, an iPad, wine of the month, and even an electric bike. So people can join us and participate, which is really great. And you'll hear some fun, uplifting messages and some wonderful speakers. So we hope that you'll consider joining us. And again, thank you for joining us today. We do appreciate it. If anyone has any questions for me, I'm happy to answer them. I didn't think so. So maybe Barry, you'd like to show us out here?
I had something to add, Eric.
Okay, please.
Even if you can't attend on September 25th, you can certainly participate even now. So if you go on our website, you know, you can buy drawing tickets, participate in Medicines for Children. We would love to have you join us on the evening of the event. That's when we actually do the drawing and pick the winners, although you don't have to be present to win. So just thought I'd add that.
And what time is the event on the 25th?
Starts at 5 p.m.
That's specific time.
Yes, thanks, Barry.
Well, I really enjoyed having you on board to hear what we're doing in the last 3 months and some of our ongoing work. And if anyone has any other questions, we'd like to answer them now, but we really are appreciative of the fact that you did enter this discussion with us. It's a great way to connect with the people that support us, and we really enjoy this opportunity to give you not only information, but to answer any questions you have about how we do it, why we do it, what we do. And so if anyone has any other questions, we'd like to answer them now. And well, thank you so much for joining, and thank you for your support. We really appreciate it. Jerry, we hope to get you on a team. And if you know of any other people that would like to go on one of our construction teams, that's our biggest need right now as far as volunteers. So thank you again, and have a wonderful rest of the day. And please, thank you. We really appreciate your involvement with us. Bye-bye now.
Bye, everyone.
Thank all of you. Thank you.
Thank you. Bye-bye.